2014, the real problem becomes the mandate and the cost, the forcing of the purchase of insurance, which many Americans find objectionable, and that you can avoid that mandate if you continue to design this as we do in the beginning.
Well,
and both plans are somewhat similar on that, but it's a very different structure.
What I'd like to do is to move on to the topic, which I think underlies...
Jay Rockefeller.
Oh, I'm sorry. We still got Jay. My apologies. Jay, please go ahead.
Thanks, Mr. President. We really haven't discussed, I think, what is at the basis of the frustration about this whole business of pre-existing conditions and lifetime limits, all the rest of it. And that is the way and the nature of the health insurance industry, for the most part. They are, among all industries I've ever encountered, and in the Commerce Committee we have spent a year analyzing and bringing out some of their sins and ills. They're terrible. They're in it for the money. A nice lady who runs WellPoint said, "We will not sacrifice profitability for membership. Money first, people second." We had a fellow named Wendell Potter who worked for Cigna for 20 years as a high executive. He came before us on his own, volunteered, and described the way health insurance companies operate. They are looking for reasons to kick you out. They are looking for reasons, if you already have the health insurance, for doing the rescissions. Yes, we're going to ban those, but not unless we pass a bill. And in fact, often employees are incentivized financially to find reasons to kick people off of the insurance which they're paying for. So you can be paying your premiums, and then they discover they come up with something they found in your background they don't like, and they just kick you off. They can do that now legally. And so people say, well, you know, maybe the states ought to do this, they can do it better. Well, that's the situation we have now, but 44 of the 50 states make it perfectly legal for health insurance companies to do this pre-existing condition, to simply deny coverage for something which people just got sick, as babies or as adults or whatever. I got a letter from the CEO of Cigna written to me, and he said, "I want to apologize because we had said that we'd spent $5 billion on the small group insurance market." Well, I checked a little bit more. In fact, we hadn't. Now, why don't people know that? Because the health insurance industry is the shark that swims just below the water. And you don't see that shark until you feel the teeth of that shark. Now, unless I be accused of trying to over-dramatize my statement, this is the way they operate. Nobody has particular oversight of them. They're not under any antitrust type rules. They can do what they want. They so dominate the market, as the Secretary pointed out, that there really isn't any real competition. They can do what they want, and they do. And it's money. It's money. And it makes me sick. It shouldn't happen in America. And people say, well, government run. You're going to do this or put that restriction on them. If you don't put the restriction on them, they're going to go on doing this. And so, you know, the public option was, I like that a lot, but that's not going to probably be possible. So you have to go at them to clip their wings in every way that you can. And that's why, and with his general agreement on pre-existing conditions and rescissions and lifetime annual limits, I mean, you know, it's not a lot of fun to see an 8-year-old kid, which I have done, and I knew this kid, Samuel Board, and he had leukemia, and he had life, you know, annual limits, and he ran out, and then he died because there was no insurance. Could they have cured his cancer? I don't know, but that's what insurance is for. So this is a rapacious industry that does what it wants. unknown in their behavior to the people of America, except on an individual basis, and individuals can't shake up us the way they're now doing it, I think. So when you talk about the individual mandate, that's not in there for some government makes that decision purpose. It's there because you got to have a big pool. Everybody's made that point. I got a son who's old enough to have health insurance. He doesn't have it. And when my wife and I found out about it, we told him to get it the next day. He didn't think he needed to have it. He would live forever. Well, that's the premise among young people. That's why we have the requirement that people sign up for health insurance. And they don't know if they're going to need it. And he doesn't know that he's going to need it. So you make everybody participate, and then you have a bigger risk pool. You can do a better job. I want to say one word about medical loss ratio, because it's sort of a crazy name, but it's a really good concept. What we say is that the health insurance industry says that they spend 87% of all of their revenues from premiums or any investment that they might have on health care. That doesn't work out quite that way. For large businesses, they do a much better job. But for small businesses and the individual market, they're down in West Virginia in the high 60s and the low 70s. So how do you stop that? You can't stop that by asking them to. You stop that by having a law, which is a good law, saying that you have to spend between 80 and 85% of everything you take in revenue on medical care for your patients. And if you don't, we will know about it because we'll be tracking it, and then you have to rebate that difference to the people. So there's a reason for doing that. It's good public policy. It can't just happen on a voluntary basis. I mean, but it's a way to make sure you get your objective. Let me just close on one other issue. The rate review, and I wish we could talk about the Medicare board, advisory Medicare board, which is controversial, but which is
well, we will have a chance to talk about it next. So, Jay, let's wrap it up because I want to make sure.
I'm going to wrap it up. The insurance rate review is important, and if Kathleen Sebelius is to be called an unelected person, and she's head of the group that does all of Medicaid and Medicare and Health and Human Services, and she's been an insurance commissioner, she's been a governor, she knows the whole thing. I don't call her down because she's not elected, but was appointed by you, and it was a brilliant choice. People say decisions can't all come from Washington. Sometimes decisions have to come from Washington, because what we're about here is not trying to run by government. We're trying to protect consumers. And if you're going to protect consumers, you've got to have a way that they really do get protection, and that they know it, and that they feel it in their lives. So this insurance reform is important. It's a profoundly emotional subject out there, and we got to do something about it.
Mr. President, Ms. Blackburn was on the list, I thought, before we left.
Okay, go ahead.
Thank you, Mr. President. And yes, one of the points that we did want to cover today was the across-state line purchasing of insurance. You've alluded to that a couple of times and mentioned that you felt like we were close on that issue. I think that there are some very important structural differences in the way we approach this, just as I think that there are very deep philosophical differences in how we approach health care reform. Now, a lot of the people that I talk to want us to start over in this issue, and they want us to give them the ability to hold insurance companies accountable One of those ways is through very robust competition. And when you have a district like mine in Tennessee where the bulk of our constituents are within 15 miles of a state line, the ability for those individuals who have families and live and work and have employees on the other side of the state line who shop for major purchases every day is to allow them to be able to make those purchases. Also, when you talk about holding insurance companies accountable, if you want to empower patients in front of those insurance companies, take the power away from them.